Hola, bienvenidas y bienvenidos. Soy Ana María Arriagada, presidenta del Colegio Médico de Chile, y me complace compartir esta entrevista con Jeffrey Sachs, quien estuvo recientemente de visita en Chile como expositor en el Congreso Futuro. Agradecemos especialmente su disposición a conversar con nosotros, ya que su mirada resulta muy valiosa para el debate chileno sobre reforma del sistema de salud, sobre equidad y sostenibilidad. Jeffrey Sachs es fundador y CEO de Sachs Policy Group, un referente en políticas de salud y transformación de sistemas sanitarios en Estados Unidos. Ha asesorado a gobiernos, aseguradoras y organizaciones de salud con especial foco en la reforma de Medicaid, los modelos de pago basados en valor y la gobernanza de sistemas complejos. Ha estado además estrechamente vinculado a la implementación y evolución del Affordable Care Act, más conocida como Obamacare, participando en debates claves sobre expansión de cobertura y sostenibilidad del sistema. En esta conversación, conducida por el presidente de nuestro Departamento de Políticas en Salud y Estudios, el doctor Cristián Rebolledo, se pudieron abordar lecciones internacionales del proceso de reforma sanitaria estadounidense y su relevancia para países como Chile. Esperamos que este diálogo resulte tan estimulante e interesante para ustedes como lo fue para nosotros. Muchas gracias por acompañarnos y de nuevo, si surgen preguntas, nosotros ya comprometimos al Dr. Sachs para un futuro webinar en que podremos contestar todas esas preguntas y dudas. Así que difúndela, mírala, anota tus preguntas y nos veremos en otra oportunidad con el Dr. Sachs.
So, well, first of all, I want to thanks to the Colegio Médico de Chile and for have the opportunity to have this conversation. I prefer to think this is a conversation more than an interview with Mr. Jeffrey Sachs, with at least for the people who has been studied the public policy, the healthcare reform is a very fundamental character in the last 20, 25 years in this opportunity. I want to present, I'm Mr. Cristián Rebolledo. I'm the president of the Departamento de Políticas y Estudios del Colegio Médico, and I'm going to conduct the conversation with Mr. Jeffrey Sachs. We're pleased to welcome him. He's a health policy consultant, founder and CEO of Sachs Policy Group, and has advised U.S. states, other countries, organizations on major health system reforms. Is mainly known your participation in the context of the Affordable Care Act in the United States. So for us, it's a pleasure. Jeffrey, thanks for being with us. As we were talking before, the idea is to have this broad view about different topics related to healthcare reforms in a country like Chile. I will say that maybe 20, 25 years we were talking about reform. Has been some interesting situations, but still we have the idea that there are some things on the healthcare system that could be still be reformed. And I think maybe something very interesting to talk is what we understand for a health reform. Maybe a good place to start will be establish a broader context from your experience. What are the main structural challenges that you think the health system are facing today, which is in a particular place of time? We were talking about the last 5 years, the pandemic, the international scenario is very particular. Which do you think they're the structural challenges, thinking across different national and institutional contexts?
Well, let me just start by, I often talk to groups, right? And first of all, thank you. I'm very honored to be here with you all. And I apologize that I made the mistake as a child of taking French. I should have taken Spanish. Everybody speaks Spanish in the United States, and I should.
Yeah,
So that was my mistake. But I like to, when I'm talking to people, I like to say that we all have a lot of experience with the healthcare system, and you don't have to be a doctor because every one of us, every one of you in this room are patients. And you know, I love when I sit with CEOs who talk about of hospitals, and they talk about the health system, with why the state is wrong or why the federal government's wrong. And I say, well, I get them to talk about their experiences and their family as patients. It's the same story that everybody else has to tell. And so I think patients have a really good view of what the problems of the healthcare systems. Look, the healthcare system is really good at taking care of people who are really sick, who need sophisticated surgery. But it becomes really hard with the chronically ill population to provide the care because the patient has to be the partner in that care. And if the patient doesn't cooperate, you know that all the medicine, all the healthcare in the world isn't going to help that patient. So the other problem, I think, and then the other thing I like to tell people is you're all experts in technology. You use technology in every single part of your life. You make it plane reservations, you stream on television, you do everything, and you want it right now, because what people want more than anything is convenience. But the one thing we don't get in the healthcare system is convenience. And I'm convinced we're called patients because we have to wait so much, and we have to be patient. And I think as the next generation comes up, they're not going to tolerate what our generation tolerated. So I do think, what differentiates our firm from other firms is that we take a position on public policy. And we actually develop policies in the office as a donation to the public sector. So in New York State, New York is around 20 million people. And we have 8 million in the city, and the rest are throughout the rest of the state. So it's a very similar scale, I think, to here in Argentina, right? And it is, so you get a lot of experience at the state level in terms of dealing with all these issues, because the state does certain things, and the municipalities do other things, and the counties do other things, I guess provinces here. So it's all a matter of coordination. And I think the biggest failure we saw was during the pandemic, when we were prepared in certain ways, but not in other ways. So there was no PPE. And, there was no, the healthcare system never took into account the fact that that the supply chain would be disrupted.
No.
And I'm sure you had trouble with ventilators here like we did in New York. And there was a real kind of divergence between the federal government and the states over resources. The one thing the federal government did really well, and that was President Trump back then, was the deployment of vaccinations, even though now he's singing a different tune. But I think that saved a lot of lives. So I think that, you could slice and dice the healthcare system. There are a million ways to do it. I've worked in this my whole life. I was trained as a dentist. And the governor of New York State tried to close the dental school. And the president of the university was a close friend of mine, and he put me in charge of the committee to save the dental school. So I went up to the governor, and many times said, you can't close the dental school. And finally, they offered me a job. And the day I graduated, I went up to the governor, and I ended up being the head of healthcare in New York State after 2 years. Not because I'm so qualified, but everybody left, so I was the last person there. So I've been reforming healthcare my entire life. And, while certain things get better, a lot of things don't get better. And so I think we were talking before about the front lines. You have to support the staff. It's just the nurses, the doctors, the burden on them is so great now. And with the initial implementation of electronic medical records, it was and clicking and typing, and it even put more burden. But there's great hope now with new technology that can listen to an interview and to look at a chart to remove some of that burden from the workforce. And I think we have to do that as much as possible. So I'll stop here because I'm going on and on.
There are many things that are really interesting. Maybe I'm going to take one of the last things that you were talking, because for the medical association, for example, and of course for other health professions association, when we talk about healthcare reform, there's something like an uncertain about this. I don't know how to say. Maybe struggle, or maybe the complexity or move for better conditions of the health system. Improve the access, improve the efficiency, improve the opportunity. But on the other hand, you have the working conditions for the workforce. I don't know, maybe one of the main issues every time is about the income, the salary, for example, of the health workers. So, in your experience, how to deal with these two forces? In some cases, they're not in the same way. I don't
No,
know.
no, we're having a nurses strike in New York right now.
Yeah, I saw on the
Right this
news.
minute, the nurses, 15,000 nurses walked out. And these are not the lowest paid people in the healthcare system.
Mhm.
They make maybe $200,000 a year. So we're not talking about the people that provide care at home or on the floors. And they work hard. The nurses are the most amazing people.
Mm,
I've gotten care in one of the hospitals myself, and the nurses are fantastic.
mm,
But you know who's also fantastic? The direct care workers, the aides, the people that come in and help patients when in the bed.
mm.
They know, and the home care. Do you have home care workers here,
Yeah,
right?
home care workers,
Not so
no,
much.
not so much. No.
But the thing that I found curious about your system is that the medical license, when people cannot go to work, the
Yeah,
insurance company has to pay for.
yeah, the medical
But
license.
so
Yeah.
that I think that is a drain of resources. Maybe that could be taken care of in a different part of the government, and not in the healthcare system.
Well, actually, this topic has been a main issue
Yeah, I mean,
the
I read
last year.
about it.
Ah, you saw that?
No,
Yeah, it's
but I agreed with it, which is why I'm raising it.
mm,
We have all sorts of assistance for people at home, but
mm,
we have a long-term care system,
mm,
which which has gotten very expensive. And now we made the mistake in New York of we now pay families to take care of their parents,
mm,
and the program has ballooned. It's now 10% of the Medicaid.
mm,
We spent $100 billion in Medicaid in New York State alone, and 10% of it is spent on this program.
mm.
So it's once you give, you know, privileges and benefits, it's hard to take them back
Mm, yeah, maybe there's something like the social security has to take care in a different
in a
way
different
of
way.
that situation that has been dealing in the last years. Now it's different. The necessities, so even what the expectations of the population about, for example, the long-term care, the family care, yeah, they're different.
Well, we are actually moving in the direction that you are in, because the big, especially under President Biden, but it's still existing at at the state level. I think President Trump administration is not that big on this, but we started to pay for social determinants of health.
Mm,
So for food and for different services that are not directly related to healthcare,
mm.
and the idea that you would prevent, as prevention, if you feed people properly, and I believe this, if people have good food to eat, and if they have access to social daycare,
Mm,
if they're older, and a place to go, it's all good for them.
mm,
But at some point, the healthcare, because the people who are healthy in a care system
yeah.
have to pay for it, because
Mm,
that's how insurance works, right?
mm,
So in the private system, so I know you had a huge fight with the insurance companies here, as we always have, about community rating.
mm.
Because in the United States, one of the good things about the Obamacare, the ACA, was, we tried to solve you wanted to talk about that a little bit, right?
No.
So I was very lucky. I got to negotiate the agreement between the Medical Association, the pharma, the insurance
Ah,
companies,
perfect.
the unions, and device makers. I negotiated the agreement where they said they would support the the Accountable Care Act. And one of the proudest days of my career was when I went to the Oval Office with all of them, and we signed the agreement. And but the Accountable Care Act, it did increase access. It gave insurance to a lot more people, and now President Trump doesn't want to extend that coverage anymore. So a lot of people are going to lose their coverage. In New York State, we're going to have 400,000 people that will, out of 20 million, that will lose their coverage. But we were successful in covering a lot more people, and there's still 2 million people that are covered that wouldn't be covered. We also, most of that legislation was about improving care. So their hospitals were penalized for readmissions, and it supplied a lot of reimbursement for preventive things to keep people out of the hospital. And value-based care was a big part of it. Paying doctors to keep people healthy, but it did not really. It was supposed to save money too, and it saved maybe 1% over the last 15 years, 1% a year. And I think yours is around 11%. Ours is around 20% still.
Yeah.
But part of the problem in our system was we have I like your system better than ours, by the way.
Yeah.
We have a lot of people on Medicaid. And that's a program for poor people, right? And then we have a lot of people who are on Medicare. And I'm on Medicare. And you turn 65 and you become eligible for Medicare. And that's a public system.
It's a public system, yeah.
So they're both public systems. And one of the big challenges we have is people who we call the dual eligibles. So they have both Medicaid and Medicare, but they're two different agencies, and they don't talk to each other.
Yeah.
And so Medicaid, if Medicaid does a good job, people aren't going to have to go to the hospital. So we're trying now to integrate this into one, and it's very hard to do. It has to be done at the state level almost, because Medicaid is administered at the state level. And I like in your country that the public option, FOMOSA, right?
FONASA, yeah. FONASA, yeah, we're talking about the insurance. Yeah, FONASA.
They insure the elderly, they insure the poor, they insure anybody that wants to go into that system. And I think that's a good system. And then you have a private system, and for people that want to be in the private system. And I think some of the reforms you're doing make a lot of sense, that people in the public system can see doctors in the private system. So they're not, right? So you're moving in that direction.
Well, actually, suppose almost the 50% of the actions from the private sector, the provision is for people in FONASA, because if they have the willingness to pay, they have the opportunity to go to the private providers.
And that's good, because a lot of the systems where people, mostly like Canada has a very good public system, and they have the right to go to the private system. There's long waiting lists in the public system, and so people should have the right, but everybody should have some basic insurance. And I think you here in Chile have done a great job of providing a wide net for people to get insurance. Now, insurance is not worth anything if you can't get people to take care of you.
Yeah, at least some. And well, actually, in the last time, almost, and that's something, because the people used to say that we have a mixed healthcare system. But yeah, it's mixed, but mainly is public. The 85% of the population is insured by FONASA, and
I say congratulations for that.
Oh, thanks.
And that is what we're trying to do we tried. Now I'm not sure what's going to happen, because the current administration is more enamored with the private sector, and they're probably going to support insurance plans that don't fully cover people, which we had a lot of before the ACA. So maybe they're covered for nothing,
Yeah. We have that. Maybe it's interesting to discuss the challenges. For example, for Chile, being in this situation, the 85% of the population is in the public insurance, 15% of the population is in the private institutions, the insurance, which there are not many. There are something like 12, 13 they're concentrated at the end of the day. But as we were talking before, the 60% of the working force of the medical, the specialization, the me- the specialists, the medical specialists are in the private sector,
Right.
which, by the way, is not distributed in all the country. They are mainly concentrated in areas like Santiago, Valparaíso, Concepción. So still, even if the 85% of the population, which is not the case, but if the people from FONASA could choose to go to the private providers, there cannot because of the geographic distribution.
Right.
So still we have a challenge
But
there.
that's where technology can make a difference.
Okay.
Okay. So right now we have, you could do robotic surgery
Mhm,
at a distance, and it's happening.
mhm,
So at some of our academic medical centers in New York, we're providing robotic surgery in Africa with local doctors, and the surgeons in New York are operating the robot.
mhm,
So I think more and more as technology moves care closer to the home, there'll be many more opportunities. But the fact is, doctors want to live where they want to live. They don't want to live in the
yeah.
rural. So it's a big issue, and rural health is a big issue in the
Mhm,
United States. And people get upset in New York if you close a hospital, right?
mhm,
And we closed a hospital that needed to be closed for one of the hospitals that I work for. And I'm a consultant. And this hospital was built so many years ago, and it was run down and
mhm,
didn't provide great care. And it was such political backlash. And and it's funny because I've been at this so long, and I've seen a lot of hospitals close. And when you're in New York City, we have so many hospitals. So
mhm,
the closest hospital was 10 blocks away. It was NYU. It wasn't like it was. So there's a war, and then it closes, and then nothing happens,
mhm,
and half the discharges go away
mhm,
because a lot of these hospitals fill themselves with people who don't need to
mhm,
be in the hospital. And that's a big
mhm,
problem we try to fight in the United
mhm.
States, that the hospitals, in order to keep their beds filled, admit people that don't belong there. So what I was thinking about when I saw how the municipalities run a lot of the hospitals, or the provinces do, right?
The provinces, yes, more,
Provinces.
yeah, they're centralized. We have a national network mainly.
And
They're
I
not municipals.
and I saw one of the things that you are all trying to do is push for integration of data, so that
Actually, it's a main issue
you
also.
have to do that. And it doesn't mean that every hospital has to have the same EMR, but they need to be connected. There needs to be a national spine, a backbone, where data can be exchanged, so that if a
Mm.
patient shows up in an emergency, you can. And that's the function I
Mm.
think, the national government.
That's something. It's an topic in which I need your opinion, because for example, you said you have to do it. There's many topics, for example, to improve technology, the telemedicine technologies for the isolated areas. There are many things in what everybody has agreement about. For example, and at the end of the day, still it doesn't happen.
Doesn't happen.
So,
Well, here's the
what's your experience in
all right,
other
but here,
settings? How to deal with that? How to move forward?
if you wanted like a theoretical conversation, there are many better people than me. Like, I have people in my office that they could talk theoretically how you create a healthcare system,
Yeah.
but it's not going to change a damn thing.
No, maybe, yeah.
I am
Looking
a
for experience.
I am a policy entrepreneur.
Okay.
Okay, so I wait for. You ever watch surfers, and they surf out and
Mhm.
they get to that wave,
Yeah.
and they wait and they
Wait. Yeah.
ride the wave. So I would look at, what is this administration going to do in the next 4 years? Now, I was at a speech where I was at a meeting where both the President Boric and President-elect Cass spoke.
Hmm.
And look, they had differences, but they both are recognizing technology. And I think President Cass, that I met his tech advisor, he's going to be very proactive on technology.
Technology.
and also on AI in particular.
Mhm.
And doctors need AI. So I would focus, I would say, this is my expression. It's hard to get government to do what you want to do.
Mm.
So I always try to do what they want to do. And I think there's an opportunity here to work with them for the next 4 years on improving the technology. I am sure these municipal hospitals have terrible systems.
Mhm.
I'm sure they have like 10 of, if things are digitized, they probably have 20 different systems, and the data doesn't transfer between the systems. But that can't be in the future.
Mhm.
And there's a way of stitching that data together now so that you can run analytics on it. I mean, I work with a company that is working with Mount Sinai in New York,
Mhm.
and they're putting a lot of predictive analytics into the hospital
Okay.
about who's going to get sepsis, who's going to have a heart attack, and they know in advance. But it's not just that technology. It's like, how do you, being smart about banding together to buy things in bulk and
Mm.
get good prices, and negotiating with pharma companies. And but technology, it exists now, and I mean, the last 3 years has been a revolution.
Mhm.
Technology is indifferent whether you survive or not.
Uh,
And so, I worked for 10 years. Is this okay? And we go,
Please.
okay. I worked for 10 years in the media business. I never left healthcare. I always did healthcare.
Okay.
But I was fascinated with the film industry and the music industry.
Perfect.
And
Okay.
there was when the internet first came, I was very involved in technology. When I worked in the Congress ran a congressional office, we went to one of the factories in our district, and it was this company called Computer Associates. It was run by Charles Wang, and he created something called the Wang word processor.
Mhm.
And young people don't know what that is, but it was a computer that you just wrote on. And I said, I have to have these in the office. And we brought them in, and nobody in the staff wanted to give up their typewriters. And they said, no, there is
Mm.
a resistance
Resistance,
of
yeah.
technology, but it will pass you by. In the United States, I worked for Disney and for Warner Music Group. And one day I walked into the Warner Music Group with a CD. And I said, this is not, people aren't going to buy music this way anymore in the future. I brought them all in something called Internet in a Box, which we all used to get on the
Yeah.
internet in the early days. They said, no, people are always going to want to hold the disc. But you saw what happened to them.
Mm.
Remember the neighborhood video stores? They're
Yeah.
gone.
They're
Remember
gone.
Blockbuster?
Yeah.
Gone. Blockbuster could have been Netflix, but they didn't. Kodak could have been, but they didn't. They stuck with their old models. And the same is true for doctors and healthcare. Doctors who don't use AI will be replaced by doctors who do. They won't be replaced.
Yeah.
But one doctor with strong technology background could take care of 100
Mm.
times more patients, which gets to the burden. And
Mhm.
so I work for a company called Regard Health. I say work, I mean consult. And what they've done for hospitals is they go into the EMR and they draft the first draft of the doctor's notes. Now, when you combine that with an ambient that listens to the interview and completes the notes, you're really reducing burden.
Mm.
And the technology exists. So I think one of the challenges, and this is a very this society has great at technology.
Mm.
You have expert engineers here.
Mm.
I mean, this is a very forward country when it comes to technology.
Mm.
So, and then you have a president that's going to want to do it. So that would be one of my highest priorities.
Interesting. I was thinking at the beginning of this conversation, you said that the people has experience in health as patients, for example, and also experience in technology. And the thing is, yeah, maybe there's a lot of situations in which the people, the patients, recognize the presence of some technological solutions in other areas of their life, and yeah, they
Well,
think that maybe in
I don't know
in
if this is good.
healthcare could be some solutions in the same way. So
I don't know if this
it's
is
true.
good. I use this from, are you there?
Absolutely. I'm here. What's on your mind?
So I want you to just explain to everybody, you and I talk about my healthcare a lot, right?
Of course, Jeffrey. Yeah, we definitely talk about your healthcare pretty often. We go over your fitness routines, how you're managing things like your AFib, and just generally keeping track of how you're feeling.
So my labs come back, I can never get the doctor to talk to me about them, right?
Yeah, I remember that. You've mentioned a few times that it's a bit of a hassle to get a hold of your doctor to go over the results in detail. And that's where we kind of jump in and chat through them together so you have a clearer idea of what's going on.
I mean, you actually found that I had 3 abnormal values, and then no one ever could explain it to me, and you did.
Exactly. And that's kind of the beauty of it.
So here's the thing.
Yeah.
Patients are going to be using this.
Actually, in Chile, there's something like 45 million cell phone lines, and we're 20 millions. And on the other hand, Chile has one of the fastest internet, very good coverage.
When I go
So
into
there's
my
an
doctor,
opportunity. Mhm.
I go to get my labs before I go for the visit because I don't want to chase them, because I want to have them and I want to be able to talk. And I asked this thing, and now Apple Health has just integrated with ChatGPT, so they have a very specialized health app now. And I say, I always get nervous when I go into the doctor, and these are my symptoms, and we go back and forth. And then I say, can you just write up 1 page? But patients are going to go in, especially young people, who they're not going to want to sit there and fill out paper when they go into an office. They wouldn't even know what to do with a pen. They don't even learn how to write in the script anymore.
Yeah, it's true. Yeah.
So doctors are going to be at a disadvantage because the patients are going to come in knowing more than they do. And, even elderly people, they have young grandchildren. The grandchildren are going to help them. This is a society with a young value there, elderly. Not in the United States, we don't. But so it's urgent that the doctors get use of this technology to support them. And that's the urgency. I think that's more important than anything else. And the hospitals, I am sure they need so many different systems to work efficiently. So, I could bring in the best policy experts, and we can do a theoretical models for all the healthcare systems, but you're just moving stuff around. I was with a lawyer last night who was complaining to me about community rating. And he was so upset about it because he represents the insurance companies.
Yeah.
And I said, what do you mean? I worked my whole life to get community rating. That's what Obamacare was. I said, how is insurance supposed to work? Like, you're only going to get insured if you're not sick? And then what do you do if you're not sick? He goes, good. So then you're going to put all the sick people into the public system and then tank the public system? So, I mean, there has to be some equity, and it has to work, and it has to be financially sound. But the healthcare system has to have these tools. And so you have a president that wants to do technology. So I wouldn't be fighting about something he doesn't want to do, because he's not going to want to do more socials, this and social that. Wait for the next president who's on the left, and you could do that with him. But I would love to work with you on this.
I think that's very interesting because you have this tool, as you say, there's some urgency about to improve technology in many ways. That's a good example. But there are other things that in the implementation of some politics is also interesting, and we were talking earlier about this. The polarization, the political polarization, not in this thing that maybe it could be more agreement, but in other.
You don't even have anything like what we have right now.
Yeah.
I listened to both presidents, and they were so polite to each other. Okay, and there were areas of agreements. I mean, they have some real differences in ideology, but in the United States, people can't even talk to each other anymore. And the left has gone, when you swing the pendulum, and this country has its own pendulum. And I'm somewhat familiar with your history. But when we went all the way to the right with Trump, the Democratic Party moved all the way to the left. So people like me, Obama, all the middle, we have no place to go. And it's a very unsettling time in the United
Oh, yeah.
States, I think. But Trump wants to do technology. Now, I know all his top people. I mean, Bobby Kennedy, who's the secretary, is a friend of mine. I came here with his sister, Kerry Kennedy. They have different views on things. But I will work with them on things that we can work on together, because you have to. You have to take the opportunities that are in front of you and not get lost in philosophical, theoretical. Because we've been trying to fix it my whole life, and it's still not working. The only thing that I see that I've ever seen, I've been doing this since 1978. The only thing that gives me a ray of hope right now is supporting the healthcare system with technology. And technology is not expensive. It's once you create it, it's there.
I was thinking just like that about the barriers, because as we said, there's some kind of agreement about the importance of going in that way. There's a financial issue, but also
I bet you could get him to support the technology stuff, because he believes in that, and he'll think it will create jobs. I think the other thing he's going to want to do is probably privatize, in a sense, like create management service organizations to help run the public hospitals. Well, I'm sure aren't run that well. And I'm not an advocate for that either. Sometimes these organizations take too much money out of the system for their own profits. So it all has to be carefully regulated by the government. There's no easy answer, right? In the United States, every different industry, they want to make as much money as possible. We still have the fee-for-service system. So the more you build, the more money you make. And the higher Trump is taking on the pharmaceutical companies right now, which I think are good. And he's about to take on the insurance companies, who make a fortune. They take 10% off the top, right off the top. And that's what, I'm not sure, I think they take a lot more than 10% off the top. The hospitals, they do amazing work, but they could be a little more efficient.
Yeah.
So, and then we have a lot of private equity that's buying up industries. They take too much money out of it. And so they're taking away from care. I mean, every answer, every solution has people who will take advantage of it. And it's really hard to account for all of that. So I'm very optimistic, though.
Yeah.
And can we just talk about large language models for a few minutes? Is that
Please.
Look, I am not like a blind advocate. These large language models have been around since 1940. It's only in the last 3 years they have developed neural networks have been around since 1940. And machine learning, we know. And the old-fashioned AI, where you get engineers, and I'm sure if you talk to your engineers now, they're going out of their minds, where they would create all of these software programs, and but then they developed these LLMs that allow the models to talk to you in English, and it's based on statistical probability of what the next word is. But the truth is that nobody knows what's going on in the underlying neural network. And they were trained on games like Atari. So I always joke with my friends that right now they are trying to get a high score and seeing how many data centers they can get us to build. So that's just a speculation. But these things are emergent, and they're doing things that nobody expected them to do. And
very fast, by the way.
It's fascinating. Look, I don't know what the future is. I don't know if they're going to become smarter than us or as smart as we are. But it doesn't matter, because we're wired. I read this book. I'm gonna really mispronounce his name, but it really made me understand how human beings are wired to create technology. And in preparing for coming here, I went and looked at that book, but not knowing that the author was from Chile. His name is César Hidalgo, and he's a physicist here. And it's a really wonderful book, and I'd recommend it to anybody. But we're not going to stop creating technology. We never have, from fire on, right? Industrial Revolution, all of it. and this will continue. So I'm nervous because I think it can go wrong, but I do think we have to use it and harness it to do good. And I think that would be a great way to focus for 4 years.
I have two questions to follow that line. First, what role should medical association play in that scenario? And the next question, which is really close, is what stakeholders, what other actors has to do with this this development?
If I was a doctor, let's say the 60 and older, they're never going to change.
No.
They're not, they're not, they're probably, they're still writing their notes probably. They don't want to touch a computer. I mean, I see older doctors. I'm so old myself, but I don't consider myself to be. But the young people are not going to tolerate. But can you imagine? You're going to say to a 40-year-old doctor, you're not going to have the use of AI to support you when you're diagnosing an 80-year-old person on 25 drugs, and you have to figure out the interactions. What these models do is everything is expressed in numbers. And because it's all numbers, it's all math, the models can see patterns. We can't see those patterns. And it's great. Why wouldn't the doctor want to be supported by a technology that can see the hidden pattern? I mean, I was a story of a person that runs an agency for people with developmental disability, which I do a lot of work in. And his kid is really sick, and he went to doctor after doctor after doctor, and he finally got frustrated. And he put everything, forget about, confidential. He just put everything, and he was desperate to save his kid. And the model came back, and this was 2 years ago. It's so much better now, and said, there are 3 drugs your son is taking. None of them alone would cause that interaction, but the 3 of them together will cause that reaction. And that turned out to be the problem. There was a study done by the New England Journal of Medicine. I'll send it to you. They had 3, this is like 2 years ago. They had 3 cohorts of patients, okay? And there were scenarios. And the first group was just physicians, and they had to make a diagnosis. They were right 74% of the time. The second cohort were physicians with the access to AI. They were right 76% of the time. Why? Because they trusted their own diagnosis over the AI. The third cohort was just AI. It was right 94% of the time. Okay? People say, AI makes mistakes. You know what the third leading cause of death is in the United States? Medical error.
Well.
Drugs, this, that, medical error. And or not diagnosing sepsis in time, or a hospital-acquired infection. This wrong side surgery. I mean, it happens. And so what I say to people, maybe it's not perfect. Maybe it makes mistakes, but it has to be better than 60%. It's got to do better than that. And that's what we should be for, is improving the status quo. And people can say, who watching me can say, this guy's crazy. He's just infatuated with technology. But technology always wins. And
yeah, if you go back in every time that we have
it
this kind
always
of
wins.
Always win. Yeah.
Technology is indifferent to whether you survive. So either you go with it and use it, or it will pass you by.
Listening to you, I was thinking even in those conditions, even the patient should prefer.
Well, the patients are going to start using it before the doctors. That's going to.
Or prefer that the doctor use the AI.
They should. Now that we always want to have a doctor in the middle. I work with a lot of tech companies, and they have all these solutions, and they go, it's so degrading though. They say, we have our human. I said, what are you calling us like? You're degrading us. Like, they're doctors. They're not humans, But you need somebody to be responsible. You can't always trust the machine to be completely right. So there is going to be, I think over time, it's, in the next 10 years, they're going to build 1 billion robots. 1 billion? And they're going to have unbelievable capabilities.
Yeah.
So I can't predict into the future that far. But if I was 40 or 50 and I was a physician, I would want all of this. If I was running a hospital, and I know how inefficient hospitals are, I would want all of this. It's impossible. It's like if you don't have technology, it's like it's like walking with gravity. You could be Superman, or you could be walking up a hill. What would you rather do? Not that I've never been wrong. I never saw LLMs coming. I'll be honest with you. I never saw them coming, but either did the people that invented them. So if you listen to the podcasts and you listen to Mustafa Soliman, who DeepMind, or Demis Hassabis or Sam Altman, they didn't see it coming either. You know, it speaks every language. I could do the same thing I just did and ask it to speak with a Chilean Spanish dialect. So, you know, it's emerging, and we don't know everything it's going to be able to do. But let's not get crazy and fancy. Just the basics we're talking about here.
So you think that could be a central issue to thinking in the challenges of the healthcare system?
Yeah, around
how to improve the technology as fast and upgrade the system.
How can you improve operations, access, rural health, with remote monitoring, with remote visiting? Mental health is a big problem. In the United States after the pandemic, it's all being done remotely. I mean, it's good, right? People that they don't have to spend an hour to go to a therapist and an hour to get home again. They get their appointment and they do a video chat. I'm not saying it's perfect, but you don't want the perfect to be the enemy of the good, right?
So medical doctors should feel the threat about they're going to be replaced.
Well, they are going to be replaced, though.
Maybe, yeah.
Those that don't get with it will be replaced. They're going to be like the neighborhood video stores.
Yeah.
That's what they're going to be.
Yeah, you're right.
You know, people think going to sit in a waiting room for an hour.
Yeah.
You think the young people are going to want to wait to get a phone call to talk about your lab scores, and then you miss the call, and you got to call them back, and you get a recording, and that's not sustainable.
Yeah.
So, I mean, I think my pitch here is that this guy will support technology, and that's where I would think about getting resources from. You know, he's not going to support, increased licenses, or, he's not going to subsidize. But this helps. I think this he'll buy.
Yeah, because that's one thing. The necessity to improve technology in this all kind of way, and the other thing is how the governments or how the healthcare system are going to finance, for example, are going to be financing the technology.
I did a lot of work in the Soviet Union. I went 35 times because I did read that they're interested in like private finance, and we use public finance. So public finance is when the government issues bonds for private purposes. So we have in New York, we have a transformation program where we give money to the poorer hospitals, and it's all financed with state bonds. And we've given billions and billions and billions of dollars to these hospitals. So it's always easier to get capital than it is to get operating money, especially if it's financed with bonds. And that would give the hospitals time to let the efficiencies, pay for the infrastructure. It's very hard when you're paying for it like up front.
Going back, which place had the technology improvement? Because we're not talking about the same technology as now, but still, 10 years ago, also there was the necessity of improve technology.
Well, they did. They put a lot of money into certain types of technology and data. I mean, I'd be happy, as I said before, we'll go very deep with you guys on a Zoom and take you through. We can answer that question in detail.
In detail, yeah. But the thing, I was thinking that this is not new. The necessity to improve, to finance technology in the path of a healthcare reform is part of the reform.
Right, and there was a lot of that in Obamacare. I just can't recall all of it off the top of my head. But I think the progression of technology has we're in exponential explosion right now.
Yeah.
It's nothing like it back then. You know, Trump is very tech forward.
Huh.
Now, you think he had Elon Musk in there to fire people?
Yeah.
He can get anybody to go in and fire people. Elon Musk was putting technology into all the government systems.
Mm.
Now, that's the other thing with technology. You could do good with it, and
Yeah.
you could do harm with it.
Mm.
The president was talking about they use AI to recover stolen cars in Chile here, and we got back a lot of cars.
Yeah.
So that's a good use. There could be bad uses. Like in China, they use it to identify somebody who's doing something wrong or protesting. And so you can't blame technology for how people use it. The other thing I
Sure.
think societies have to look like is total cost of care.
Okay.
And that's something which I've failed at because I wanted to have not even like penalties. I just want to make it all transparent in New York
Mm.
so we can see like which industries are accelerating. So let's say we agree that healthcare expenses can grow at 3% a year.
Yeah.
And you want to see who's growing at 10%. I mean, the pharmaceutical companies
Yeah.
in the United States are getting away with murder because they're subsidizing all their research in the United States. And they were paying, poor diabetics were paying so much money for drugs, and then Obama stopped all that. And Trump is being very tough. He's going to be tough on the insurance. I can't wait to see him go after them. I'm not saying there's no reform and you can't think about it, but if you have a bunch of academics, professors going, you can't show me a single healthcare system that doesn't have all these problems.
Yeah, of course.
None of them. Canada, Britain, England, National Health Service. At the end of the day, you got to provide the care. And if there's not enough physicians and there's not enough providers, people are going to wait.
Yeah.
And then the big part of it is how do you get people to participate in their own care? I'll use myself as an example. During the pandemic, I was just doing like these bicycle and I lost all my muscle mass. And I went to the doctor afterwards. My labs were terrible. Cholesterol was high and everything. And then I started exercising like crazy because I wanted to get my muscle mass back. And I was amazed that all my lab scores went back to perfect again. And so people really have to walk, they have to move. And old people have to move too. I mean, surgeries today, they get you up the next day. You're not just laying in bed for 2 weeks.
Yeah.
But I think that is the hard part of healthcare is how do you get the patient, I like to call them consumers. How do you incentivize them to do the right things for their own health, to eat healthy? And, it's just so important. I mean, doctors can't do all that.
No.
And they don't listen.
There are many other areas of the society that could be engaged to the idea of get a better health for the population, the educational system, the environmental system. There are many other places, and sometimes it's hard to realize that the health of the population play in that area more than even inside the healthcare system, inside the hospitals.
I'll give you an idea. Let's say health licenses don't belong in insurance, but we will take that money and invest it in technology for our institutions, for our patients. Make a trade. Let other parts of the government should be financing people that can't work. Now, it shouldn't be a healthcare expense. It makes no sense. It makes the system non-sustainable. So, you got to find the revenue. Fine, here's the revenue. But I think it's an unfair burden on your healthcare system. I'm not saying people don't need help when they can't work, but it's an unfair burden on the healthcare system, and I'm sure it's abused. People like people taking care of their parents in New York. It's terribly abused.
Yeah, for sure.
There was a commercial on TV, and this young woman it went on TikTok, went viral. Said you could just make money helping your parents. And
For sure,
it was called
yeah.
CD Pass.
So
I think this is where the Trump administration is really doing a good job, is they're cracking down on fraud, and they're bringing technology companies in to help them attack fraud. And that's going to provide resources that could be used to support the healthcare system. I'm sure you have a lot of fraud too here.
Yeah.
I mean, everybody does. I mean, the problems are the same. I worked in the Soviet Union. Problems are the same that went back then. I'm sure they haven't improved that much.
Absolutely. No doubt there's a lot of things to have a interesting reflection about this topic. Jeffrey, I want to thank you for the time.
I enjoyed it too.
Okay,
And I can
thanks.
offer, if you want to go into a technical conversation, I'd be happy to do a Zoom. But I want to just say I have appreciation for medical doctors and nurses, and I work with the unions in New York. They're one of my clients too. I've been working with the healthcare union since 1978. I started a foundation for John F. Kennedy Jr., where we help direct care workers go to college and advance. I'm very grateful to the workforce in the healthcare industry. But we just still have to improve it to them and for the patients and for all of us.
Absolutely. Well, thank you so much
Thank you.
for this time. And of course, we're going to have interesting conversations.
I'm always available if you want to
Okay,
talk.
thanks. It's going to be like
You know,
that.
I love
Absolutely.
talking about this.
Thank you. Okay, muchas gracias. Chao.
Colegio Médico de Chile.